Am I clear, everybody? Yes. Now we will come to what are emotions. Emotions हमने पढ़ लिए हैं what are emotions, but emotions are any agitation or disturbance of mind. Any kind of disturbance of mind is emotion. You are not getting a bus to go to the college and you are getting late. Anxiety, emotion. You are worried whether I will get my result good or bad. Emotion. So any kind of disturbance of mind is emotion. Any kind of feeling is emotion. Any kind of passion you are working for is emotions. It includes anything which disturbs your peace of mind. If it is temporary, amygdala has not created an alert because neocortex is not hijacked. If it is permanent, it is coming again and again and again. That means neocortex has been hijacked and amygdala is an alert, right? And your primitive brain is pre-programmed. Am I clear with the concept? This was the theory which I wanted to explain you before taking the disorders. Now, we will link this theory with the today's topic. I call it EBD, emotional and behavior disorders, EBD. For an individual to suffer from emotional and behavioral disorders, it requires the following characters. Patient comes to you. How will you judge that the patient is in emotional or behavioral disorders, or is he normal? Right? So I would like to share with you one of my personal experience. There is a boy. Daily what happens is, daily on the mail, some parent has complained about, has been violent to my child, is throwing spits, thuk phekna, to the children, is eating chalks, is hitting our children. And one time what happened was, I was hitting a child and the child fell down and he got hurt on his forehead and there was bleeding in the class, right? So daily on and off, the ERP is full of the complaints. And that boy is very restless. He holds on the child and he does not know from where to hold the child. He holds from the cuffs. Sometimes he's holding from the hairs. He pulls the hairs. When somebody even touches, he becomes violent. But he is not in a knowing, or in this knowing that he is violent. He comes, he talks to you very nicely. He is good in studies. He writes very good, but he is not very perfect in bringing the homeworks, getting the copies checked, and he is very good in communication. He goes to the family functions, but his behavior is like this in the class, right? Now, after I will tell you this slide. After this, you tell me, is he normal or is he in EBD, right? So whenever a patient or a child comes to you, how will you judge that the patient or a child is in EBD? First of all, the child would have challenges in learning. Learning would be difficult. Ma'am sikha rahi hai, not learning. Delayed learnings. Trouble keeping or building satisfactory relationship with the peers and the teachers. The EBD child would not have a satisfactory relationship with the teachers or the parents or the peers, the siblings, right? The teacher would always be complaining. If he would go for playing with the cousins and all, the cousins would say that he would not come. He would not cooperate in the games, right? Inappropriate behavior against self or others. He's spitting. He does not have an inappropriate behavior with himself or the others. Overall attitude of unhappiness. Either the child is unhappy or he's in depression. Also, sometimes a patient comes to you, child में वो child वाली हरकतें नहीं होंगी. The child would not behave like a child of 3 years. He would be behaving like a child of 7 years or a mature child, right? Tendency to develop physical symptoms as fears related to individuals or school issues. Right? Fearful हो जाएगा to go to school. Fearful हो जाएगा to teachers. So these are the conditions. These are the things which if a parent comes and tells you, you can judge that this is going towards EBD. Now, in EBD, there are two behaviors. One is internalizing behavior and the other is externalizing behavior. Internalizing behavior is when a patient with EBD gets squeezed. Squeezed means he is not throwing out, he is throwing on himself. He is getting introvert and reserved. but he is throwing everything on him. He is getting depression, he is getting quiet, he is having poor self-esteem, he is not confident. Usually nahi hai कि if a patient is coming to you with a behavioral and emotional disorder, he has to be violent only, he has to be in depression only, he has to be abnormal in school only. If a child is coming to you and he has low self-esteem, if a child comes to you and he has depression, and if a child is coming to you, he has loss of he is not social. If somebody comes to your home and the child goes in the room and hides, he's not social, he's not social with the friends, he's not social with the mother's friends, his academic and other activities are low, he's not good in studies, he's not getting proper marks in the subjects, and he usually nahi hai कि he is having suicidal thoughts, maybe he is having suicidal thoughts also. Okay? He injures himself whenever he is in stress, he injures himself, he hits himself in the wall, or he cuts his fingers, right? So these are also considered as EBD. देखने में वो बच्चा will be very calm, देखने में वो बच्चा will be very very quiet, but these things also lead to EBD. This is not that the child is very obedient. He is not obedient. He is internalizing EBD. Internalizing means keeping everything inside. He is not throwing it out. Okay? So these are also called emotional and behavioral disorders, but this falls in the category of internalizing behaviors. The patient may be diagnosed as, if he goes to allopathic doctor, they diagnose it as anxiety disorders, post PTSDs, post-traumatic stress disorders, OCDs, panic disorders, eating disorders. Some kids eat only, khai jana, theek hai? But they are not violent. So this slide is for telling you that in your clinic you can encounter these. This is a disease, EBD, and this is internalizing EBD. Next is externalizing EBD. Externalizing EBD, patients shows external behaviors. External behavior means they get violent, they are angry, they respond to anger, like Balihar. He responds to anger very violently. He pulls the children, he hits the children, he throws the children on the ground. He even hits them so badly that he does not know that the child gets hit on the table and there is bleeding from the forehead. The child is unaware of this. This is externalizing behavior. The child is frustrated, disappointment. Okay? These children who are externalizing, they become usually bullying. In children में क्या आएगा? Bullying आ जाता है. They bully other children. They are threatening other children. If you will not do this, I will do this to you. अगर आपने ऐसा नहीं किया, if you will not give me this pencil, I will hit you. If you will not do this, I will tell this to your papa. This is threatening. This also comes in externalizing EBD children, right? They threaten the other children. They provoke other children. How do they provoke? They hit and they run. And the other person comes to hit them back, they become aggressive. So these are the conditions of externalizing EBDs. They become insulting to others. तू ऐसा है, like insulting behavior to the others. ठीक है? कई mother-in-laws insulting है daughter-in-laws के लिए. They are externalizing EBDs, right? They are externalizing EBD children. They are cursing. They are fighting. They all things whichever in their mind, they externalize it out. On the contrary, internalizing behavior, they keep it inside. They become quiet. And this externalizing, they throw it to the other person. They make the other person realize that you are wrong. You are below us, right? So these are two kinds of. In this category falls, पिछली कैटेगरी में क्या आया था? पिछली कैटेगरी में आया था एंजाइटी डिसऑर्डर्स. इंटरनलाइजिंग में एंजाइटी बढ़ जाती है. पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर्स, obsessive compulsive disorders, these are not violent. Panic disorders, eating disorders, these were in internalizing behavior. और externalizing में क्या आया है? Usually it comes ADHDs, right? ODDs, ASDs, spectrum disorders, bipolars, conduct disorders. जो महारानी वाला केस था वो किसमें है? अब इंटरनल में कि एक्सटर्नल में? एक्सटर्नल में. यू मस्ट बी नोइंग. ठीक है? तो कोई भी केस इनमें ये डिसऑर्डर्स आ जाते हैं, ठीक है। और स्पेक्ट्रम डिसऑर्डर्स सारे इसमें आ जाएंगे, डिफाइंट डिसऑर्डर्स आ जाएंगे, ठीक है, बाइपोलर्स आ जाएंगे, कंडक्ट डिसऑर्डर्स आ जाएंगे, ADHD फॉल्स हेयर, हाइपर एक्टिविटी डिसऑर्डर्स, सब एक्सटर्नल बिहेवियर्स में आ जाएंगे। Am I clear? So we have categorized into two, the first and the second. So today बहुत सारे हैं, we will take only three today. First, oppositional defined disorder, ODD, oppositional defined disorders, and the second is conduct disorders, and the third is ADHD. Okay, time I think is going. ODD, conduct disorders, and ADHD. ठीक है. Oppositional defined disorders में क्या है? To a quick thing. Oppositional defined, patient become defiant everybody knows, and he becomes opposed to everybody. Opposed means I do not have to obey the teacher, I do not have to obey the parent, I do not have to obey the doctor. Defiant, no, I will not do this. Behavioral disorder, ठीक है, this is also a behavior. क्या? I will not do this. Irritable mood, no, I will not do this. Argumentative, बच्चा अगर आर्ग्यूमेंटेटिव है, पेरेंट बोल रहा है ही इज वेरी आर्ग्यूमेंटेटिव, ही डज नॉट ओबे एनीबॉडी, ही इज वेरी वायलेंट, ही इज इरिटेबल, ही इज विंडिक्टिव, ही इज इन which EBD, externalizing, right? Behavior is usually towards the siblings. He hits the other siblings, right? He is spiteful, he blames others, he do not follow rules, he is angry, he loses temper. All this comes under ODD. In short, ODD is physical and mental aggressiveness. ODD is this aggressiveness. In this case, it is not physical aggressiveness, it is mental aggressiveness. Nothing physical, only mental. He is not physically violent, but he is not obeying the other. He is very spiteful, he is vindictive, he says no's to everybody, he is not obeying the others. He says mental aggressiveness. Okay. इसमें we will go to other. What is the cause behind? The cause can be वही जो हमने आगे डिस्कस किया. Why is amygdala in alert? Why is the ODD child is an alert? Because it can be negative parenting, जो pre-programmed है, parent-child conflict, substance abuse, dysfunctional family, लड़ाइयाँ चल रही हैं, inconsistent discipline by a parent, insecure parent-child attachment, parent is not giving proper time to the child, proper love to the child, he is forsaken, weak bond with the parent, family irritability and stress. All these create this kind of ODD, that is defiant disorder. Now second is conduct disorder. Conduct disorder is that the patient or the child is not in a good conduct behavior, he is not in a good social behavior, he is in theft, he is in physical violence. पिछले में हमने देखा there will be no physical violence, but he is not obeying. इसमें हमने देखा there will be physical violence also. Balihar comes in this category, conduct disorder. He lies, he thefts, he is physically violent, he is destructive, he is anti-social with the children, with the elders, he is anti-social. इसमें क्या क्या symptoms आएंगे? Malicious, bullying, abuses आएंगे, इसमें crimes आएंगे, substance abuses आएंगी, injury impulsivity, कि I have to do this, I have to do this, and he injures the other person. ठीक है? So this come in conduct behavior. If the parent says that our child hits everybody, if a parent says that our child does not affect whether there is bleeding or not, conduct disorder. Physical violence, right? Complications. These things, when the child goes to sadomasochism, self-injuries, crimes, substance abuses, violence. These children often initiate fights. These are the initiators of fights. लड़ाई की शुरुआत ये करते हैं. Cruel to people and animals, right? They are cruel to people. They don't like animals. They hit animals. They beat animals. No remorses, no empathy, and they are deceitful. This comes in conduct behaviors. Third is ADHD. ADHD symptoms arise from execution. इसमें execution dysfunction है, emotional dysregulation है. These are the two things which ADHD necessarily has: is execution and emotional dysregulation. Difficulties in self-regulations, time management, inhibitions, sustained attentions, causes poor professional performance. There is no professional performance. The child is very, very shy, or the relationship difficulties are there, health risks are there. All this comes under ADHD. ADHD is associated with neurodevelopmental and mental disorders, as well as non-psychiatric disorders. All this comes under ADHD. So these three are the things which I wanted to discuss you. But we don't have to go to the symptom. We have to go why child is like this. Why is his brain pre-programmed to have like this? Why is his the cortex not working? Neocortex not working? Why is the neural circuitry of violence there? Either why is the SORA? There is SORA behind. Has it come from the mother or nanny or whom? This we have to search. In Organon, yahi cheez what Organon is saying in 205 is, homeopathic physician never treats one of the primary symptom of chronic miasm, nor yet one of the secondary affections that result from their development. This is what I'm trying to explain, that we will not treat the symptoms, primary symptoms or secondary symptoms of the disease. Homeopathic medicine never treats this, but he cures in cases where the one or the other appears, only the great miasm on which they depend. We have to treat the miasm. We don't have to treat ODD. We don't have to treat ADHD. We don't have to treat conduct disorders, CDs. We have to treat the miasm on which they are functioning. We have to treat what is behind. We have to treat the SORA, whereupon its primary and also its secondary disappears spontaneously. Dr. Hahnemann has clearly written, when we will treat SORA, the primary and the secondary symptoms will go simultaneously, spontaneously, yani immediately all will go when you will treat the SORA behind. But as this was not the mode pursued by old schools who proceeded, the homeopathic physician, ye aap pad lena because time is short, you can read this aphorism. My purpose of bringing this aphorism to your notice was that in every aphorism, either mental diseases or others, Dr. Hahnemann has only emphasized on one thing, that we do not have to treat the symptoms, either primary symptoms or secondary symptoms. We only have to treat the miasm on which they are based. We have to treat the SORA on which they have based. The SORA which is active behind, the amygdala which is creating fear. But what kind of fear and why? This we have to treat. 227 says, aphorism, but the fundamental causes in these cases is also soric miasm. SORA, clearly he has mentioned, is in the background, which was not quite yet near its full development. For the security's sake, the seemingly cured patient should be subjected to anti-soric treatment in order that he may not gain again and again the mental disease. That if we will treat on the symptom medicine, it can palliate, but we have to catch the SORA so that the mental symptom does not come again and again, so that it again and again does not come back.